So the session now we've got for the next hour is a sort of more open, dynamic one. So again, hopefully it will keep you awake and keep you engaged. And the challenge, it seems to have sort of come up already, isn't it, is around how we look after each other and how we develop teams that look after each other. People who know me have heard me say this before. I'm always really impressed by the research of Professor Michael West. I don't know if any of you have come across him. He's another one of the famous Sheffielders. Coming towards the end of his career now, and all through his life, he's looked at what are the determinants of quality in healthcare. And he was involved in lots of the seminal reports for NHS England after crises like the Stafford's crisis and the Alder Hey crisis and so on. And what always comes out of his sort of reports and his research is that if you want to look for the one marker of quality in the NHS that predicts everything, predicts A&E wait times, it predicts mortality rates, it predicts wait times in general practice. It's basically how the team feel. And I've sort of paraphrased that in how meaningful and manageable is your work. And that seems to come out in research as being a really, really key thing. But it's not easy to do. So we've gathered together 3 panellists who have some experience in this area, and they're going to sort of start us off with a little sort of 5 minutes or so, sort of some of their personal experiences, and we've deliberately selected them because we see them as real innovators and leaders in their field.
I'm Lorraine Brickell. I found it quite amusing earlier when Sarah Withers talked about bringing your brick. Bearing in mind I have a brick in my name, so I thought that might be a good place to start today. So my role, yes, I'm a health and wellbeing coach for Mid-Chiltern PCN, which is down in Buckinghamshire, northwest of London, so a few hundred miles south. I'm also a team lead for the health and wellbeing team, which consists of some health coaches and a care coordinator, and the majority of my team are here today, which is nice to have them here. So really today I'm just talking about 3 areas that I'm involved in terms of promoting staff wellbeing. So firstly, within our PCN itself, we very much value and support our staff, as obviously we should do. And as myself in my role as a team lead, I'm very big on open communication, having that shared space for my team to bring ideas to the table. So in terms of service development, things like that. So we meet twice a week online, have discussions around anything really, areas of concern in terms of patient consultations, anything that might crop up. So we're always happy to have those open discussions with everyone. I also have monthly one-to-ones with the staff. I have that also with my line manager. And as I said, so I very much try and foster that sort of approach really where to make the staff feel valued and obviously then enhance their well-being as such. And then within our PCN, we have regular team meetings, the whole PCN. We've had away days like team building activities, which have been quite entertaining. So again, it just fosters really a sense of sort of worth and belonging. So that was the first area I just wanted to talk about. The second area is the work that the My Health coaching team has done with some of the GP practices. So we basically cover 5 practices within the PCN. And last year I approached the practice managers about doing some work with the health coaching team to enhance the well-being of the staff out at the surgeries. Because obviously whenever we go out there, we're aware they're under incredible pressure, always seem very overwhelmed with their workloads, etc. And thought it would be really important for them to have some time and space for them to actually come together and just share things, share ideas in terms of how they can improve their well-being at work. So we went out to their PLTs, so they sort of have a PLT every month when they sort of close the surgery and they can have that time. The practice managers created some questionnaires, each practice sort of did their own questionnaire, but they just around staff wellbeing, and so obviously staff didn't have to fill it out, but some did, and we then used those results in terms of our health coaching sessions. So we went out there and ran some group health coaching sessions with the staff off the back of the results of the questionnaire, and I thought it would be quite good, rather than just having the whole practice staff in one room, to actually split them up into different groups, and decided to settle on splitting them into admin staff and clinical staff, because I felt that the sort of stresses in those roles were could be quite different. So that's what we did, and it's worked really well. So I predominantly took the admin staff for each of the surgeries I went to, and my colleagues took the clinical staff, and we just literally had a group health coaching session with them, and just gave them that space to speak to, as I said, any areas they wanted to discuss. We used health coaching techniques, and we made it very solution focused. So the idea was that, you know, not just them having a moan, oh, you know, got too much to do, blah, 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 but, you know, how can you then improve that? What steps, you know, what could you implement? So, as I said, very health coaching oriented. And then I literally collated all the comments that had come back from the two groups, and I emailed the practice managers those comments. Obviously, they were anonymous. But they then, obviously, it was then down to them to decide what they wanted to do off the back of those results. And it's been really successful in the sense that we're now going back again this year to repeat the thing out at each of the surgeries. So that was the second area. And then the third area really is just to talk a bit about the importance of peer support. So in Buckinghamshire, a couple of years ago, we set up a peer support network of health coaches, and there's about 12 of us now. And we literally meet once a month. I'm not going to single them out, but there are a couple here today as well, which is nice to see. But really just the importance of having that network of health coaches where you can share ideas and share knowledge and experiences. And that's been really good, having those online meetings and discussing that. And then, in terms of myself, I'm actually also still in contact with the ALS group that I worked with when I did my level 1 course here with Peak Health, and also a couple of health coaches that I did level 2 and 3 with. And again, I would really encourage you to kind of keep those kind of groups going, because they're so good in terms of anything as a health coach you can discuss with them. And as I said, and just in terms of your own well-being, it's really good to have that network around in order to do that.
Don't be fooled by the slight accent I've got. I've been in Lincolnshire for 20 years, but I'm still a Yorkshireman. So, the work that I do. So my name's Matt Evans, and as Ollie mentioned, I work across the integrated care system in Lincolnshire with the personalisation team. There's 8 of us, and we've got different employers. So the county council employ 4. 3 of us are within the NHS, and 1 in a company called LVET, which is the Lincolnshire Volunteer Engagement Team. And that's like a membership body of I think it's 1,200 voluntary community, faith, social enterprise, you know the acronym. It's them lot. And together we've been able to work to support training and all sorts. But the thing I wanted to share with you today is something that it's not officially launched in Lincolnshire yet, but we're actually 2 years into a journey, and it's something that we've called the Our Shared Agreement. Which sounds really, really simple, doesn't it? And the reason it sounds simple is because we've co-produced it with people with lived experience, and they said, call it what it is. And that's common sense, isn't it? But we sometimes get wrapped up in various different things, don't we, in acronyms, etc. So the Our Shared Agreement work, it's built on 5 foundations, and again, they've been co-produced, people with lived experience telling us the kind of things that they want to see in what we're calling a developed relationship between people and the health and care system. So I don't want to kind of paint a really bleak picture for Lincolnshire, but, you know, we've got as issues, as we all have. We've got a struggle, whether it's financial or time or the ageing population. I'm sure, if anyone doesn't know, Lincolnshire's that bit you all drive through to get to Norfolk. And if you open your cupboards when you get home and have a look at your carrots, they were probably grown in Lincolnshire as well. It's sparse, it's flat, there's not a lot there. But there are 850,000 people, and there's a lot of people that move to a place called Skegness. Yeah, you all know Skeg. There's a bit more than just Skeg, but that East Coast, there's a lot of people migrate across the East Midlands and come and retire and live by the coast. So the ageing population, the pressures that puts on us, that gives us another stream to be kind of working with. And through the Our Shared Agreement work, we're looking and we're saying, well, this ageing population, all these factors that get us down, how do we improve that? And we're absolutely convinced that there is a mutual responsibility from both sides. The system has to support people better, but people have to be built to be able to support themselves better as well. And that's the journey we're starting. And we officially launched this work on the 3rd of July at our It's All About People conference, which is for Lincolnshire staff. And Ollie came last year and spoke as a keynote for us, hence why he's dragged me in today.
Tit for tat.
Yeah, tit for tat. So our system is really putting a lot of effort into working on this new relationship, or this enhanced relationship. So where it gets really interesting for the teams bit is we are all users of the health and care system. We're all patients at some point, whether it's when we're born or later life. At some point, we're going to be a user of the system. So what does that feel like for us when we're going to access it? And what support do we want to have? And how do we want it to feel? And often by just saying that to people and reflecting that back, we start to build a group that kind of go, oh yeah, hang on a minute, we are all in this together, whether we are the public or whether we are the service deliverer. So one of the things that we've tried to do is a program called the It's All About People Champions. And this is where our personalisation champions, and at the moment, I'll be honest, there's about 70-ish, and it's people that we've worked with already. Maybe they've been on shared decision-making training, or they've been on health coaching training, but it's people we're aware of, and we're building a community with those professionals to kind of go, we're going to be the champions that are going to keep asking the questions. We're going to be the people that remind our colleagues about the shared agreement. We're going to keep pushing back into the system at different points. So that could be adult social care, it could be in a voluntary organisation, it might be Jim's Gym. Reference for the dodgeball fans? No? So that push back into places to go, remember, we're talking about a new relationship with people, and we've all got, with the system, we've all got responsibility in that. So our champions are becoming our team. And everything we do around personalisation, because it's everybody's business, it's not just our team, our 8 of us banging the drum, it's everybody's business. We're trying to build that culture where we are all in it together and we're all going to be part of this new relationship. So a couple of little programmes off the side of that, things like, he refers to his notes because he's forgotten what he's on about. Patient activation measures, that got mentioned earlier. So we've been using that as a measurement tool, and we're starting to see a social return on investment through that as well, which has been really, really interesting. But is it sustainable? All those questions coming up. The champions I've mentioned, the shared decision-making measure for, it's counting buttons and string at times, but are shared decision-making conversations happening? We think we're getting towards 40,000 now on a template that say yes, but what about the quality behind them? What does that actually mean? Are they using the resources? And people, what resources? And you go, we've got on the NHS England website, and there's 16 are we at now, shared decision-making tools to be used. So, yeah, the counting bit's a little bit old school and a bit rubbish, but it's a starting point. And building that team around, okay, we've got some shared decision-making training, we've got some champions that are advocating it. Together, maybe we can start looking at what that quality looks like in that relationship. So that's where we're going. And it's about building the community, not just, when we think community, we often think about the people, don't we, and people and community settings, but no, the community of practitioners. Could be a micro community of, physios on a hip and knee pathway working together. Or it could be a bit bigger community where we go, hang on a minute, somebody that needs a knee operation that's moved to the East Coast that might have a housing issue or might not be able to work, so there's work and pensions type thing, or might need a blue badge or citizens advice. How do we make a community around that person where we can all share and understand what each other's roles are in supporting them with their healthcare in that moment?
That's a hard act to follow, Matt. It's really good, thank you. And I think that's what we're aiming towards as primary care networks, is to kind of involve community. And that's the heart of it. In terms of kind of talking through my experience, Ollie's already mentioned, but I work as a PCN manager in Sheffield in Healy Plus, working with Ollie as clinical director. And I'm just going to talk you through the journey that we've had in trying to build teams in our network. And we all know that, when 5 years ago, when Primary Care Networks were started, we had, I think, was it 4 or 5 roles, and that's grown. And there's a huge menu of staff you can choose from, and where do you start? I think understanding what your population needs are is crucial. And when you've got staff from being employed, we've got around 30 members of staff at the moment in the PCN, and some are employed through the PCN, some through the voluntary sector. You've got the Federation, you've got other organisations, Sheffield Health and Social Care. And when you've got multiple organisations you're working with, staff sometimes feel lost because they don't know who to report to, they don't know who to go for support. And sometimes I think primary care networks can be quite a lonely place. It can be quite a challenging space to be in. And it does add that layer of complexity in what you're trying to do. And what we quickly learned is that staff definitely need to feel part of a team. They need to feel supported. It was important to have a point of contact, have a team leader for individual teams, and space. We've heard quite a lot around space, having that space and time to be able to come together, especially when staff are kind of spread across 7 or 8 practices. It's really difficult to have that sense of belonging. And sometimes PCN staff are sort of seen as another group coming in to offer a service for patients and don't really feel part of the practice teams. And I think kind of the underlying principle of all of this is that as a network, we really believe that additional role staff really add value in the non-medical preventative space. So some of the work that we're doing is trying to how do we complement the medical care offered by the practices? So how do we work along with practices, and how do we complement them in providing holistic care to our patients? So who is part of the team? So we've got 3 teams in place in our PCN. We've got the pharmacy team, mental health team, and the personalised care team, which is a sort of a new team. We've had to amalgamate 2 teams together because we have had to restructure recently. And each team is supported by a team leader who's usually quite a senior member of the team. And it was an interesting question which was asked earlier this morning about what about the clinical roles? Are they part of this personalised care approach? And I think as a PCN, what we've tried to do is to involve both clinical and non-clinical staff. We've got the clinical pharmacists who we're trying to integrate into some of the PCN projects to try and understand what kind of aspects of shared decision-making, self-care, and all those aspects of peer support is all crucial in empowering patients to be able to look after themselves. And what and how, I think, is... I think primary care networks are a brilliant space for innovation, and I feel privileged to be part of that because you have that headspace in a setting where sometimes things can feel so fast-paced, and it's appointments back to back, and it's very reactive. And you do feel for your colleagues who are having to be there on the front line trying to, it's almost like a battle, isn't it? You're on the front line trying to manage the demand, the complexity which is coming through the front door, and complexity which doesn't always involve the medical side of things. It's broader than that. So it's just, and the thing is, what we've tried to do is not just have a kind of a linear approach. It's important to have a test and learn approach. And I think sometimes in primary care, we do struggle to adopt that mindset. It's a real culture shift. We've had clinicians who've, when we've offered half-an-hour appointments for women's health clinics, come to us and say, "Oh, that feels like a luxury. How are you doing that?" And I think it's going beyond thinking of quantity. It's not just about quantity, and we've touched on that quite a lot this morning as well. It's about the quality of the interactions, which really really matter. And I think it's important to allow staff as well to be able to develop, having space. So, for example, the pharmacy team, it's important to build that into the rota. So 80% of their clinical time is in practices, but 20% is kind of allocated to team building, PCN projects. We give them a lot of autonomy to be able to develop their own projects, so they come up with some really interesting ideas and they're allowed to run with it and try things. And they do, there's always going to be barriers to various, and that's where we sort of try and support and step in as well. I mean, I'm not saying this is not without challenge. It's been kind of very interesting 5 years of working with conflicting priorities. It's been a challenge, and I think when you're in an innovative space, you're always going to face that challenge. And I think also when finances are tight, it's just being mindful, and it's important to take to take people with you. And that sometimes involves taking 5 steps forward, 10 steps back. Sometimes it feels like that. But despite the storms, we've seen quite a lot around waves and storms and kind of rough seas. But despite all that, I think the benefit of team working is that you've got other people to support you in delivering that change. Thank you.
Lovely, thanks guys. Some lovely perspectives there, really interesting. So, I mean, you've heard a few things there. So, Lorraine talking about, dynamically proactive, looking after your team as a team leader, but then also extending that out to the wider team. I love that idea about doing that. And Matt, this sort of like contract with your local people, really involving people in what's going on, and looking all the time for new tools for measuring things. And Sheruba, they're sort of talking about the value of teams, with team leaders, with space, physical space and time to work together. And I love that. If I talked about believing, start off with, you talk about belonging, which I think sounds really important. So I'm just throwing out